On April 1st, 2025, the National Institutes of Health, NIH, informed the American Academy of Pediatrics that it had eliminated its participation in the 30-year Safe to Sleep campaign. The purpose of this campaign is to prevent babies from dying in their sleep. I'm Christine, reporting and narrating for Crystal, STEM Now's anthropologist, STEM education researcher, and a political activist. For about 30 years, the National Institutes of Health funded the Safe to Sleep campaign through the Eunice Kennedy Shriver National Institute of Child Health and Human Development, the NICHD. Proponents of the Safe to Sleep campaign have worked tirelessly to prevent babies from dying in their sleep. A major focus of the campaign is preventing sudden infant death syndrome known as SIDS. SIDS occurs when a seemingly healthy baby, less than a year old, dies unexpectedly in their sleep. It is also commonly referred to as crib death. The risk factors for SIDS include babies sleeping on their side or stomach, sharing a bed with a parent or caregiver, using soft bedding or bumper pads, and sleeping on an incline. In 1994, the Academy of Pediatrics, AAP, a professional organization of 67,000 pediatricians, along with other organizations, partnered with the NICHD to launch the Safe to Sleep campaign. Within the first few years of the campaign, the rate of SIDS dropped by 50%. The 2022 AAP policy statement recommends that babies should always sleep on their back on a separate, flat, and firm sleep surface without any bumpers or loose bedding. It also recommends that while babies can share a room with parents or caregivers, they should not share a bed with parents or caregivers. Additionally, the AAP policy states that babies should not routinely sleep in car seats, strollers, swings, infant carriers, or infant slings. The link to the AAP updated 2022 recommendations is in the video description below. The Safe to Sleep campaign created materials with these up-to-date scientific-based recommendations about how babies can sleep safely. These materials were developed to be culturally appropriate and translated into different languages for many communities. The Safe to Sleep campaign distributed these materials to parents, doctors, nurses, midwives, and community organizations across the country. Despite its success in substantially reducing the number of infant deaths, the Safe to Sleep campaign is still desperately needed. In January 2025, research published in the Journal of American Medical Association Pediatrics found that from 2020 to 2022, the rate of sudden unexpected deaths in babies less than 1 year old increased by about 12%. Initial research suggests this increase is due to the COVID-19 pandemic, parental opioid use, and misinformation on infant sleep practices spread on social media. For the time being, the Safe to Sleep materials are still available on the NICHD website. The link is in the video description below so that you can download them while they still exist. The AAP and partner organizations, including the American College of Obstetricians and Gynecologists, First Candle, and the American SIDS Institute, are committed to continuing the Safe to Sleep campaign. However, these organizations simply do not have the resources or the nationwide reach of the NICHD. On Wednesday, May 14th, in testimony in front of Congress, Kennedy revealed his ignorance about the importance of the Safe to Sleep campaign. When questioned by Senator Angela Alsobrooks of Maryland, he could not correctly name the institute that ran the Safe to Sleep campaign. She also embarrassed Kennedy by informing him that the institute that ran the campaign was named after his aunt, a fact he was clearly unaware of. When Senator Alsobrooks confronted him about firing everyone in the office that ran the Safe to Sleep campaign, he lied about having fired scientists.
Nevertheless, let me go on with my questions and ask you this. You just heard about the Safe to Sleep campaign, and you have made cuts. You made it very clear here today. You have no knowledge whatsoever of the absolutely amazing scientists and researchers who you have callously fired. You know nothing about the cuts.
You can fire any working scientist, Senator.
That, sir, is not true either. But nonetheless,
it is true.
It is not true. Let me ask you another specific question. The Safe to Sleep campaign. Well, then can you name, sir, which office the Safe to Sleep campaign operates out of?
Which campaign?
Well, that's the one that the senator just asked you about 2 minutes ago that prevents babies from dying in their sleep. A 30-year program inside your agency. You would agree that it's important.
I think it's part of HRSA or ACF. It's ACF.
No, actually, it's in Health and Human Services.
Yeah.
And I think, and again,
No, they're
very,
all within Health and Human Services, but the subdivision is ACF,
no, actually, the name of the office
Administration
is
of
the
Children and Families.
No, let me tell you what it is. The National Institute of Child Health and Human Development. This is actually the one that your aunt, Eunice Kennedy Shriver, is the person who it's named after. And you noted just a moment ago, the senator reminded you that although this is a very important agency, prevents babies from dying, this is the same one you fired every single person in this office as of April the 1st. It is also,
As I said, there were no working scientists fired during the RIF.
we can bring you that information later, but because what you just said is not true.
Kennedy's ignorance and callous disregard for the Safe to Sleep campaign and the other health programs under his direction confirms that he is unqualified to be the Secretary of Health and Human Services. Together, we can save the Safe to Sleep campaign. Please talk to your family, friends, and community about the importance of this campaign and how it saves the lives of babies. Encourage them to contact their elected representatives, whether they are Democrats or Republicans, and tell them you want the funding for the Safe to Sleep campaign restored and the staff rehired. Remember, babies have no political party, so it is up to us to advocate on their behalf. Thank you for watching. Please subscribe to this channel, like and comment on this video.